I'm Mary Beth Nelson. A lot of you look very, very familiar to me, so thank you so much for coming back again and again each month. And for the new people that are here, we're glad that you're here. We do have monthly Lunch and Learn programs sponsored by Cornerstone Healthcare, High Point Regional, and Premier Imaging. Premier Imaging does have a booth set up over here, so please make sure that you get some of the goodies and important health information over there. Premier Imaging is located in the lower level of this building. We provide CT scans, MRIs, and mammograms. So please keep us in mind if you need any of those services. Again, we do offer these programs monthly. It is sponsored by High Point Regional, Cornerstone Healthcare, and Premier Imaging. So thank you for being here, and I'm going to turn it over to Pam Goldberg.
Thank you very much, Mary Beth, and I'd like to echo Mary Beth's words. We're really pleased that you're here, and I just want to say a special thank you to all the people wearing red who kind of got the theme here. That was really well done. And I also, and so you get an extra iced tea for that. But seriously, as Mary Beth said, the reason people ask us, why do you do this? And the reason that we do this is because we feel very strongly that we have a tremendous group of physicians and healthcare providers in this building who, frankly, have more experience in this building, in this area, and more education than anybody you're going to check out on the internet. And we feel that if you're going to get healthcare information, especially about topics as important as your heart, that it's best that you get them from practicing physicians, that if you need them, you know where you can find them in this building, very convenient to where you work or live. So we're doing this as an introduction to provide you with accurate, up-to-the-minute healthcare information. You are welcome to come every month. You are welcome to bring your friends, family. We're just putting it out there for people that are interested and want this information. Next month, I'm working on this, and I can't confirm yet, but it is colorectal cancer month, and I'm trying to get a doctor, one of our gastroenterologists, to come and talk about everything you wanted to know about colorectal cancer and we're ashamed to ask. So we'll see how that goes. I think that's a topic that people are extremely interested in, and I think we need to make sure we do have the most up-to-date and important preventive and treatment information on that topic. So we're working on that, and be sure that as soon as we have that information, we will not only post it on the Cornerstone website on the homepage, we'll also have flyers around this building. It is my privilege and honor this afternoon to introduce you to Dr. Fareed Al-Khori. Dr. Al-Khori has been practicing cardiology in our community for 12 years. Time flies when you're having fun, I guess. And we are very, very happy he's here today. Dr. Al-Khori went to medical school at the Damascus University School of Medicine in Syria. He completed his internship and residency training at Mercy Catholic Medical Center in Darby, PA, which I believe is right outside of Philly, is it not? Mm-hmm. And he completed a fellowship at the Medical College of Pennsylvania Hospital in Philadelphia, PA. Dr. Al-Khori's special interests include nuclear energy, invasive cardiology, cardiac MRI, CT, and pacemakers. I am looking forward very much to his presentation today, and without further ado, I'd like to introduce to you Dr. Fareed Al-Khori of Carolina Cardiology Cornerstone. Thank you.
We celebrate Valentine's Day, and we consider this month is Heart Month. Let me just explain to you about the heart before I explain to you what could go wrong with the heart and why everybody is concerned about the heart. During the next few minutes, I will cover these bases: what's the heart and how does it work, and what it might go wrong, and what should we do about it, and why do we care about the heart. The heart is very small. It's the size of your fist. If you look at your hand fist, this is your heart. However, it's the main engine. We cannot live without it, like your car. If the engine in the car is not working, you are not going to go anywhere with that car, no matter what make or what model is that car. So the heart itself, it has 4 chambers, and these chambers are connected with valves. And the heart muscle, it's supplied by oxygen through small vessels. We call them the coronary arteries. And of course, in addition to that, like in your house or in your car, there is a network of wires to conduct the electricity in the heart. The heart itself is located in the chest, is protected by the cage, the chest cage, the ribs, and the sternum, and surrounded by a small sac to protect it from infection and make the movement of the heart more smooth. This is a picture of the heart. This is the main chamber of the heart, which is the left ventricle. And this white structure here is what they call the mitral valve. The mitral valve controls the blood flow from the left atrium to the left ventricle. Sorry. And of course, from the left ventricle, when the main chamber contracts, it pushes the blood through the main artery, which is the aorta, through the aortic valve, which is this structure, the white structure here. And on the right side of the heart, we have the right atrium, which collects the venous blood from the body and goes through the tricuspid valve into the right ventricle. And of course, the right ventricle pushes the blood through the pulmonary artery and the pulmonary valve into the lung to filter the blood and get oxygen before it circulates into the left system. I mentioned that the heart muscle itself is supplied by oxygen through the coronary arteries. They are tiny arteries. You could see them about 1 to 3 millimeters in diameter, but this is the major blood supply to that engine, if you will. If we lose that blood supply, the engine will fail, and definitely we will not be able to survive, or we will have limited lifestyle, if you will. The coronary artery system consists of two systems. One is the left, and you see here the main artery, which they call it the left main, or the widowmaker. That vessel, if it blocks, most of the times the patients will die unless we could revive them in good time. That widowmaker supplies two main branches: left anterior descending artery in the front of the heart, and the left circumflex goes to the side of the heart. And on the back of the heart is the right coronary artery. You could see this is the angiogram. If you hear, I'm sure you have relatives, friends who had heart catheterization. And this is what we see. We inject contrast dye into the coronary arteries after we advance catheter into the heart and take pictures, X-ray pictures. They look like that. And I mentioned that there are wires in the heart to conduct electricity and control the way the heart pumps blood. So it goes from the upper chamber to the lower chambers. And we'll get back to this to point out what could go wrong with the system as well. And I mentioned earlier that the heart is located in the chest, is very well protected. You cannot feel it. You cannot press on it. If you feel some chest pain and you press on it and trigger that pain, it's not in the heart. You cannot, even if you want to, unless you open the chest and open the sac around the heart to feel the heart. And as I mentioned earlier, the heart is surrounded by a sac to make the movement of the heart is more smooth, to protect it from infection. And even that small sac, it could create problems. So what does the heart do? So as I said, it's made of small muscle. It pumps blood about 70 beats per minute. On average, of course, we differ. Some of us, we will have 40 beats per minute, and others maybe 100 beats per minute. Depends on our training and our conditions in general. If you add that together, it beats about 100,000 beats per day and pumps about 5 to 6 liters per minute, and it makes a total about 2,000 gallons of blood. Imagine, how sophisticated this pump Any engine you have, after a few years, you have to replace it, you have to fix it, but the heart keeps working continuously for years to come. And I mentioned earlier that really we cannot live without the heart for more than a few minutes. If the heart stops or it failed to pump blood, we are dead, basically. Just, I want to add something for you to understand, because nowadays a lot of our patients, they request doing procedure in a more convenient approach. Nowadays we do the heart catheterization through the arm. Most of it, of course, if possible. Just trying to emphasize, the circulation system is a network, it's connected, it's a sealed system. So you could access the heart from any of these tubes connected to it. It doesn't have to be from the leg, it could be from the arm, could be from the neck, could be from anywhere else, providing that it's within the sealed system. So, and this system supplies the oxygen to all our organs, including the brain, the kidneys, liver, and even all other muscles in it. So basically, if you see the blue color, which is the venous system, it brings the blood with carbon dioxide back into the heart, and that goes to the lung to be filtered. And the blood, after it releases the carbon dioxide and the waste, it gets loaded with oxygen, comes back to the left heart of the left side of the heart, and then it's pumped through the main artery, which is the aorta, the red color there, into all the organs in the system. What can go wrong in the heart? Let me go back to the components we are talking about. So we have the coronary arteries. Those arteries, like the other circulation system, they could get hardened like other arteries in the body, like the kidneys, the carotids, or your arms. The plaque is usually started from our teens. All of us, we will have some plaques build up. However, the speed we build the plaque is different. It depends on a lot of factors. We will touch on them in a second. But if the plaques that build up is so fast, and they get to a degree that they prevent the blood from going the right direction or supplying oxygen to part of the heart muscle, this is when we call it could have heart attack. Because the muscles without oxygen, they are dead, basically. This is exactly what I'm talking about. So you have this plaque builds up in the arteries. The lumen of the artery becomes narrow and narrow, so the blood supply becomes limited. Even at rest, we might not feel it, but if we exercise some, we might feel that we are having chest pain because we cannot deliver oxygen to the heart as it should. Of course, if we have a thrombus or clot on that plaque, or small plaque even, that a clot could prevent the blood flow completely and block the artery completely. This is when we call that this individual having a heart attack, and we could deal with it. And you could see here the color of the muscle when you block the artery, how it changed. And really, this is what happens. If you see it live, this is what happened to the heart muscle. Symptoms we should all be aware of. How to make that diagnosis, or at least seek medical attention in time, because time, a muscle is time. If you delay your presentation with acute heart attack, that muscle is not going to recover. And if the delay is long, it could be lethal or fatal for that individual. The most common, though, individuals, they have different symptoms. These are textbook symptoms. Not everybody have them, and they should not be followed literally. I mean, you could describe the chest pain as heaviness. Others, they might say it's a pressure or squeezing pain. Others, they might have pain in their back. But these are the most common things, like discomfort in the chest or the jaw, and feeling weak or lightheaded, chest discomfort, shortness of breath, nausea and vomiting, diaphoresis, which is sweating or cold sweats. Definitely, if you feel that the symptoms consistent or suggestive of heart attack, really you should call 911 instead of relying on your family or friends to pick you up or drive you to the hospital. Because, we've seen it, we've seen most of it. I should not say we've seen it all. We've seen people driving their spouses to the hospital, but by the time they get to the hospital, it was too late. And you don't want to experience that. Just to touch on the typical symptoms, though, especially in women, symptoms could be completely different. Going back to the risk factors, why some of us develop plaques faster than others. There are two subgroups of factors here. One of them, we cannot do anything about it. If you were born to a family with a strong family history of heart disease, you cannot change your genes. You could blame it on your father and mother, but it doesn't help you much. Male, usually, they do have the disease earlier than female due to the fact that females, they are protected with their hormones. However, they catch up very quickly. After 55, they do have the same risk as men. And believe it or not, we've seen it even with young females. Just last week, we had a patient who was 40-year-old, went up for bypass surgery because she has severe blockages. And of course, her father had his bypass at age 53. And I think her brother had bypass as well. So, I mean, these factors, really, we cannot change them. The most important thing for us all, the factors we could change. And all of us guilty of not doing enough to protect ourselves. The most common risk factors we could modify is high cholesterol. It's simple, we don't feel it, but it's the substance of plaque buildup in the arteries really should be controlled. Normally, our system should handle that. However, with aging, our system cannot handle that, and we have excess of cholesterol. So we have to modify our lifestyle to help our system handling the cholesterol. Maybe our behavior is not enough, then we might have to use medications. That's okay. Don't listen to your neighbors, to the TV, to the radio. Just listen to your doctors, because they give you only one fact. Oh, this cholesterol medicine almost killed me. But not everybody the same. You don't know the circumstances why it could have killed them. Most of the times they had muscle aches and they thought that it was about to kill them. However, don't listen to your neighbors or friends or family members. Everybody has their own system. They have their own risks. Unless you correct these risks, even if you have to take medications, this is okay. High blood pressure is another risk factors. We don't feel it. We don't see it. The only time we find out if we check our blood pressure or if we have a stroke or cardiac event. Diabetes or high blood sugar is very common. I think part of it is our diet, our lifestyle as well. However, large number of patients, truly they do have diabetes. and they have to pay attention to it. If you are diabetic, truly diabetic, your vessels, they are 10 years older than your age. Just simply being diabetic, it hardens your vessels more. It makes the handling of the cholesterol more difficult. It affects your kidneys more. So if you are diabetic, pay extra attention to your other risk factors, and you should really control all of them even better. Smoking. We are in the tobacco country here. Everybody lived on a farm with tobacco, or they had their grandparents smoke. They continue to smoke. We think it's acceptable social behavior to smoke, or becomes tradition. Smoking is the worst enemy for anybody. If you are diabetic and you smoke, you increase your risks of having heart attack by 10 times. Just remember that number. If you are diabetic and you smoke, really, it just jacks up your risks. Overweight and obesity, it became really, it's a disease in this country. Even childhood, we see a lot of children, they are obese and overweight. We should thank internet and devices for that, because nowadays everybody just hooked up to their, computer or whatever gadget we have, instead of playing outside or being active and, looking for themselves. Poor diet. Not every thin person is without risks. If we don't pay attention to our diet, we could increase our cholesterol level to a degree that is not acceptable and increases our risks. Fast food is marvelous. Look at us, it's ready, packed, and you don't have to.
Dr. Al-Khori, this is grilled chicken. Baked chips and fruit.
I understand that, but just an example. It's easy to just take a box and go, regardless of what's in that box. And most of the times you don't have choice. And most of these, even grilled chicken, I don't know. I cannot speak for any restaurant or anybody else, but we don't know if they are processed chicken, if they are really organic chicken, So
It's non-processed, we're the non-processed.
the other thing is activity. As I said, really, it's amazing when you go to a grocery store and see people rounding around, driving in their car, waiting for somebody to pull out from front of the Harris Teeter or Food Lion. I mean, they waste more time, they waste more gas just waiting to find somebody to pull out. I mean, really, there is no reason for it. You could park at the end of the car park and walk. Walk 2 minutes. It's not going to kill you, even if it's raining. I mean, I understand for women, they don't want their hair to get wet. But, that problem, I really, I don't have a problem with it. But truly, 2 minutes, it's not going to kill anybody, even in the rain. Alcohol, I don't know how much do you follow diet on in the media or on TV. The Mediterranean diet focus on alcohol, however, not the way we use it here. Alcohol in moderation. They recommend like 1 glass of wine every night for females, or a few nights a week, not every night. Not get drunk and get a few bottles of wine or a few bottles of whiskeys, that it could damage. And I will show you how it damage the heart muscle itself, or it could create more problem with the health of that individuals, plus the financial aspect of it. Imagine how costly that, if you add that to cigarette. Most of the alcoholics, they do smoke. If not cigarette, they do smoke something else, I guess. A stressful life, I don't think we could modify it much, but probably we should learn to live with it or find the best way to handle our stress. All of us, we have certain amount of stress. The only difference between us, I handle it different than the way you handle it. And probably everybody has to find the way to handle the stress with less stress, if you will. Let me touch back on the valves. I mentioned the valves, this white structure on the screen here. What could go wrong? Heart disease is not limited to the coronary artery disease and heart attacks or angina. Heart disease could be involving this small white structure on this picture. We could be born with abnormality like the most common one is the aortic valve. Instead of being 3 leaflets, it could be 2 leaflets. And that eventually it will get either narrow or leak. And most of patients who have this congenital abnormality, they will end up with valve replacement. There is no treatment for that except correcting the valve, replacing the valve. Of course, there are other reasons for the valves to get bad. The most common one is aging. With aging, the valves, they become calcified, hard to handle, they cannot open as normal, and the same way, there is no special treatment. However, there are promising news that it's in research now. We could fix these valves with a catheter like what we do with heart attacks. We could replace the valve with a catheter. It's still early, but it's very promising. It has been approved, one of the valves. Currently, not everybody is entitled or could access that service. But we're hoping to have it available to our patients in this area very soon. The alternative would be replacing the valves. Some of the other valves, they could get infected, especially in drug users who they inject themselves with needles. These needles, you don't know how dirty are these needles, and they could get bacteria into the blood and get seeded on the valves and destroy the valves. Some of the valves, they do leak, and the reason behind that is different. All of us, we might have minor leakage of the valves. It does not mean that we have to fix all these valves. When the leakage becomes severe and causing the heart to work harder, because I don't know how much did you grasp the way the heart works. The blood goes in one direction only. But if you have a leaky valve, the blood goes the wrong direction. And to compensate for that, the heart has to work harder to compensate for the wasted blood, if you will. This is an example of what they call it aortic stenosis here. Is the most common disease, especially in elderly patients. We have a lot of aging population now, and we see it very often. However, it's not limited to the old patients. In young patients with congenital abnormality, they could have that valve problematic and required surgery or intervention. I touched on the other mitral valve prolapse. I guess the old days, everybody has a murmur they call, you have mitral valve prolapse. We still see patients, they say, oh, I have mitral valve prolapse. Who told you that? My doctor 10 years ago. I guess maybe the definition has changed, or we were lax then and label everybody with murmur with mitral valve prolapse. The mitral valve prolapse, if it is associated with significant leakage of the mitral valve, then it requires to be repaired or replaced. While I'm talking about the mitral valve per se, repairing the mitral valve becomes more common nowadays, and it gives more hemodynamic positive way for the heart, instead of removing the whole valve with all the structures around that valve. You see all these, what they call the papillary muscles, they attach to the heart. If you remove the valve, you disrupt that structure and makes it less physiological, if you will. So nowadays for the mitral valve, we have what they call it mini thoracotomy, where they don't have to open the chest up. They go from the right side with a small incision between the ribs and open the upper chamber of the heart and fix the mitral valve as if they do it from the opening chest. It's very appealing to young females if they don't want their chest to be open, and the outcome is really good. There are few surgeons they do this procedure. We don't have it in High Point, but we're hoping to have it soon. However, the surgeons in High Point, they have association with other institutions where they could do it. Okay. The other thing, if you remember, I pointed out the heart is a muscle in 4 chambers. We pointed out what could go wrong with the arteries, with the valves, but the heart muscle itself, something could go wrong with it. The main chamber of the heart could get weak, and this is what they call it cardiomyopathy, or if you hear people saying congestive heart failure, because the pumping chamber fails to do its job. The reason for that, it could be different, the same with any other pathology we mentioned during this talk. I'm not going to bother you with the detail, but one of them is congenital, where the heart muscle is very thick. The problem with this pathology, it makes the patients prone to have arrhythmias and could be lethal, could be, deadly arrhythmias. Of course, the treatment, we have treatment options, we discuss it individually, is not very common. However, the most common weak heart muscle is what they call it dilated cardiomyopathy. This is where other reasons which we encounter on daily basis could cause the heart muscle to weak. And this is what I was mentioning about alcoholism, because this is one of the most common reason for dilated cardiomyopathy, people who drink and drink and drink. Cancer treatment, it could affect the heart muscle. Unfortunately, treatment for that is very limited. However, we could symptomatically at least improve the symptoms of the heart failure. And if we realize that early in the treatment plan, we could change the chemotherapy with the oncologist, of course, because we have other options nowadays. We have wide variety of chemotherapy. They do not affect the heart as the old chemotherapy we used to have. You hear about patients, they had bypass surgery once, twice, or 3 times, or they had multiple interventions. Eventually, these patients, they develop scars, because every time you have a heart attack, true heart attack, that piece of the muscle is dead, so becomes like a scar, like when you cut yourself. And that scar does not work. And eventually, if you have too many scars on the heart, really the heart muscle gets dilated, inefficient, cannot run as normal. And if you compare it to the engine in your car, really cannot run that car without some help, like pushing your car, if you will. I'll touch quickly on the electrical wire in the heart. This is small, very small fibers conduct electricity. They could cause a lot of arrhythmias, or lack of arrhythmia, if you will, the most common thing is your heart goes very fast. And the most common arrhythmia we see is what they call it atrial fibrillation. I'm sure you have other family members or friends who mention that rhythm. The rhythm itself, I just touched base on the most common arrhythmia, which is the AFib. However, we have other arrhythmias common in young people. They call it supraventricular tachycardia. It gives you symptoms, does not kill you, but it's really annoying to especially young people who they don't want to have medications or take medications regularly. Most of the times we could handle that either with medication. If they don't, we have procedures we could burn or ablate that circuit, because what happened, we developed short circuit in the electrical system, and we could burn that and cure that problem. Ventricular tachycardia is very lethal rhythm. We don't see it very often except when you have a heart attack or you have other reason like the hypertrophy I mentioned. You're born with it. Your heart is very thick. Of course, the conduction system could get rusty like the wires in your house. After 10, 15 years, you ask the electrician to replace certain wires. The same thing with the heart. We might end up having to put a pacemaker in to help this conduction system. So the elderly people, they do have this problem very common, and you see many of them, they walk around with pacemaker. Nobody know about it except them and their family, and they live decently with that. I touched on atrial fibrillation. I said this is the most common type we see it, and it's devastating not because it's lethal rhythm, but because it could cause a lot of morbidity. About 15% of stroke patients, they have this rhythm, and this is why we don't like it, and this is why the treatment of this rhythm is more demanding, because to protect that patient who has this rhythm, you need to protect them from having a stroke by putting them on blood thinning medicine. And of course, especially if the patient is older, the risk of bleeding is as dangerous as the risk of stroke. And always we have to balance between the benefit they might get from the blood thinning medicine and protecting them from stroke and the risk of bleeding and causing more harm. Believe it or not, the cost of treating patients with atrial fibrillation nationwide is about less than $7 billion a year. That's what we are talking about. It's very devastating rhythm, annoying to the physicians and the patients. Some of us, we don't feel it. We walk around with this rhythm without any symptoms whatsoever. And not everybody with this rhythm should be on blood thinning medicine or should be treated for it. I would suggest that you should consult your doctor before you embark yourself on any treatment. Just to be aware of the symptoms, mainly palpitations basically. Some patients, they might feel about to pass out. And as I mentioned earlier, we could burn this rhythm as well, the same as for SVT. There are electrophysiological procedure where we could burn this rhythm. And in our practice, we have 2 physicians, they do that with excellent outcome. Why should we care about the heart? I don't know if you believe that or not. Every 20 seconds, somebody is having a heart event nationwide. 2008, more than 616 people died of heart attack, which is about 25% of all deaths. the majority in the room are female. Believe it or not, still heart disease, the #1 killer in women, not the cancer or breast cancer as everybody perceived in the past. Still heart disease is the most or #1 killer in men and women, but particularly women because they perceived if I have a cancer, this is the end of the story, but it's not. Cancer nowadays could be treated, and definitely it's the not #1 killer in women. Heart disease is. Every year, about 750,000 Americans have their first heart attack, and about 500,000, they already had one or two, because we see that very often. If you see in a patient with heart attack, you will not forget it. The patient will not forget it. As soon as you fix them up and they feel good, they forget about all the symptoms. They go back to the bad habits. They go back to smoking. They go back to ignoring the medication or instruction. They go back not to being active. They eat burger every day or fried food. Or, I mean, you know, believe it or not, we see it every day, multiple times every day, that patients, when they are sick, they are dying for help. As soon as they feel better, they go back to their old habits. The other financial issue probably now with the economy in this country, or in the world actually, about $110 billion spent on coronary artery disease a year. If you add other heart problems like valves and weak heart muscles and arrhythmias, the total dollar amount is $360 billion a year we spend on heart issues. What can we do? Here we go back to what we started. Just be active. Go out, walk about 30 minutes a day, most of the days. You will have the time to do it. Don't park close to Harris Teeter entrance. Really, it does not help you. Just park on the other side of it. Check with your doctor if you should be taking aspirin. Aspirin is very cheap medicine. Of course, it has potential risks. However, the majority of patients, they will, or people, I should not say patients, people, they should benefit from it if there is no contraindication. And the most common contraindication is bleeding or allergy, of course. Find out if you have high blood pressure or high cholesterol. I mentioned earlier, nobody feels them, either of them. You don't feel if you have cholesterol or if your cholesterol high or not. You don't feel if your blood pressure is high or not, but check them out. And if you have either of them or both of them, treat them effectively. If you smoke, please don't come to our office. No, seriously, quit smoking. Smoking is not your best friend. As I mentioned earlier, if you smoke and you are diabetic, your chances of having heart attack is 10 times if you are a non-smoker. Diet-wise, healthy diet is always appealing to anybody, although it doesn't taste as good as a burger or fried food. However, you know, after you listen to what I said, maybe it might be worth compromising on the taste of the bad food with good food. Follow your doctor's instruction. Do not listen to the neighbors or your friends or your family. They don't know the whole story about you, although they think they do. If they reacted to one medicine, it does not mean everybody will react to the same medicine. they base their opinion about whatever they read or heard on the news, which is not completely true. You know, you take anything and you could present it in any way and show to be as lethal or as helpful as it could be. Just listen to your doctor, and you'll be better off than listening to your neighbors. So check with your doctor. Once a year is not a big deal. And if your doctor has concern, he will refer you. We will be more than happy to help anybody who thinks that they have heart trouble, or your physician thinks that you have heart problem, or risk factors need to be modified. Diabetes is a very common problem, and believe it or not, is not all diabetics, they have their diabetes under control, in spite of multiple reminders to them, to their physicians. Either they don't get a grasp of the severity of the disease itself, or maybe they ignoring it. Just a few points to answer the question about your neighbor saying don't take the cholesterol medicine. Let me just show you a couple of facts about cholesterol. The cholesterol is the core buildup of plaque in your system. And as I showed you in one of the pictures, when the buildup becomes severe, it will block your artery. If you have heart disease and lower your cholesterol, you reduce your chances of having another heart attack or intervention or bypass surgery. So treat that cholesterol. Forget about what the neighbors say about it will kill you, or I would not take cholesterol medicine no matter what. It's better than dying from heart disease. Just live with the dream of being healthy and enjoy your life without the fear of the medication, because really it prevents recurrence of heart disease or heart attacks. All are connected together, really. If you are physically active, if you exercise, you don't have to spend a lot of money to join a gym. You could walk in the neighborhood, you could walk in the house, you could walk at work, you could walk in, superstores, you could run in a park. You don't have to spend the money. Money is not the issue. However, your understanding of your health is more important than the money you are worried about. And you don't have to go to the gym to exercise. You could exercise anywhere. Combine that with decent diet, it will reduce the chances that you will need medication to control your cholesterol. However, if you have heart disease, probably cholesterol medicine, it will help you. Regardless of your numbers, do not follow the number of your cholesterol strictly if you have heart disease. If you have a heart attack, I don't care if your bad cholesterol is 70, I want it to be less than 70, and I want to give you cholesterol medicine because I am doing my job and serving you to protect you from having another heart attack. The same with the blood pressure. As I said, nobody feels if they have high blood pressure. You might feel if you have very low blood pressure, but this is different. If you have high blood pressure, you need to treat that and treat it effectively. These are the guidelines, but of course, if you come to our office or to any physician's office, you see the white coat, your blood pressure will go up. So do not rely on one reading. Check your blood pressure at home, check it in the convenience store, and base your judgment on multiple measurements, not only one measurement. There are many tools to diagnose heart disease I'm not going to bother you with, but we are fortunate enough to have all the modalities in High Point Regional and Cornerstone. I will stop here and answer any question. Yes, ma'am.
When they do a physical and they do an EKG and they compare to other years, what are they looking for? How does the EKG help them?
Well, if you have normal EKG a year ago, and this year during your physical examination you have some changes, they could reflect that you developed either a blockage, or you had some uneventful or asymptomatic heart attack, or you developed valve disease, or your heart enlarged. You know, all these things could trigger curiosity to the reason behind the changes. Does that answer the question? Yes, ma'am.
If you have plaque buildup in your arteries and you take medication or you do exercise or do things to help, does it actually remove the actual plaque that has built up?
It's a very good question. It does not. However, it slows the progression of these plaques. There are a lot of studies trying to prove that point, exactly that point, that could we reverse the buildup, but we cannot. Definitely we could slow the progression or even halt it completely, but we cannot reverse that buildup. And all of us, we start the buildup from our teens. Yes, ma'am.
Why is heart disease so difficult to track in women, even though we have a family history of fathers and brothers with heart disease? We still hear that it's hard for heart disease to be tracked in females. Why is that?
Well, for other reasons we don't understand, mostly genetics basically. And that problem affects both men and women. Although the protection effect of estrogen in women delays this presentation, it's not effective at all the time. So this is why we see young women with heart disease in spite of they are still menstruating and they have enough estrogen on board. I remember a young lady, she was 26, she was running, doing everything by the book, and she had a heart attack while she was running. So, you cannot predict everything. However, it does not mean that we should leave it for chances. We should do the right thing for ourselves to enjoy our life and being healthy.
But if you're in that type of situation, regular EKGs and things like that, and a good diet and all that, I mean, you're doing all the preventive things you can do at that point, other than your genetic pool, correct?
That's correct.
Okay.
Yeah, I mean, the genetic, you cannot change it. That's,
Fire my brother.
so, yeah. You could fire your mother or father, but it doesn't do any good. Yes, ma'am.
So at what age should, a woman like me have an EKG? I don't get that with my physical every day.
Well, you have to remember EKG per se, it has very low threshold, less likely to pick up any disease. Your symptoms are more important, and modifying your risk factors more important. The symptoms are the leading reason for you to seek medical attention, not the EKG. But of course, if you are at a certain age and they do routinely EKG and they see some changes, that becomes, another reason for them to question what happened here. But your symptoms are the most important one.
Dr. Al-Khori,
Yes, ma'am. Hey, Gwen.
the affiliation with Duke, how is that going to impact us here?
From medical point of view, you mean? Yeah. Well, it's like having a backup plan for more sophisticated procedures we don't have here. Like we mentioned about weak heart muscles. They do have devices, what they call it LVAD. So we could send our patient there to have that device to help them or bridge them to go to the next step, either transplant or treating their underlying disease to correct that problem. This is one example. Of course, a transplant is the other example. Third is research. We will have access to their expertise and knowledge. And of course, as well-known medical schools there. So, it's just supportive, if you will, more than anything else. If we need some help, we know where to go or where to send our patients to. Does that answer the question? Any other question? Yes, ma'am.
With the family history, we've been talking about, if your family has very strong family history, should a woman every few years have a good cardiology checkup? I mean, just to go, even without symptoms, going in?
Well, what I would recommend that you start with your doctors. It's worth to check your cholesterol, make sure that you are not diabetic, make sure that your blood pressure is controlled, and be on the alert, if you will, to report any symptoms to your doctor. And if you are not happy with whatever your doctor provides, you always have the right to seek cardiology opinion. But I don't want you to live in fear, just because your family history. Unless you have symptoms, nobody would do anything drastic to explore that. However, if you have family history, you should focus on your correctable risk factors, if you will. Does that answer the question?
I came a little bit late, and I don't know if I heard anything about symptoms, but with women, the symptoms can be very different, right?
Exactly. I pointed out, I don't know if anybody remembers it, but women in general, they are special. They do have different symptoms.
We are special.
We are.
Sorry.
Any other question?
Well, I'd just like to say thank you very much, Dr.
Oh, thank you.
It was a wonderful meeting.
Thank you.